We're joined by Dr. Yalda Safai. She is a psychiatrist and also a medical doctor. I appreciate your time this morning. So breathing air pollution, we know it's bad, but what are some of the underlying health concerns in specific areas? Let's start with big cities, what people should be watching for.
Sure. When you're talking about air pollution, you're talking about ozone pollution and particle pollution. Ozone pollution comes primary from power plants, refineries, and motor vehicles. Since the passage of the Clean Air Act in the 1970s, signed by President Nixon, we've in general seen a decrease in ozone across the nation. So we've been doing pretty good with this. However, some Western states and Southwestern states haven't been so fortunate. Another thing you have to think about is particle pollution, which is dust, soot, smoke, which also comes from motor vehicles, power plants, wildfires, and any coal burning type of fuels. So unfortunately, California has, global warming has not been kind to the state of California. So we're seeing the worst type of ozone pollution and particle pollution in this region of the country, primarily because of the increase in wildfires. In addition, there's a lot of industrial work and agricultural work in this part of the country. So California, unfortunately, is carrying the major burden of air pollution. You got to keep in mind ozone pollution and particle pollution both can cause immediately asthma exacerbation and then long-term respiratory disease or cancer. So one thing we could do with this is to try to pass more strict laws regarding ozone pollution and the amount of ozone that's permitted in a certain area in the air, and also working to make zero emission motor vehicles will be the first start.
Is this just a big city problem? I mean, we typically hear about it in some of our larger cities, but how about in rural areas and some of the pollution we're talking about?
It could affect different places, but we're seeing most of it in big cities, and that's it's no surprise. We have more motor vehicles in big cities, and we also have more power plants or industrial work or agricultural work in big cities. So we're primarily seeing this burden in the larger cities. However, polluted enough, it could spread to the entire nation.
Right. It's all interconnected. This new data from across the world about vaccine hesitancy in 52 countries of 55 surveyed, pretty troubling given what we know about vaccines and disease prevention. What's your overarching message on this?
Like you said, this is a worldwide phenomenon, according to the UNICEF, and not just the U.S. It's partly because of misinformation, political polarization, and mistrust of governmental agencies, and politicization of science and medicine in general has caused people to fear or delay getting vaccinations to their kids. And I think we haven't had a case of people dying from polio or diphtheria or measles in such a long time that people have forgotten how devastating these childhood illnesses could be. And the thing is, they're completely preventable. So it will be incredibly unfortunate to see a resurgence of any of those conditions that could be easily preventable by a vaccine. Now, keep in mind that with vaccinations, you have something called herd immunity, which means a certain threshold of the population needs to be immunized in order for the entire population to be protected. So as cases start falling and falling and falling, you have to worry about herd immunity failing, which means people who are already vaccinated could also be at risk. So this is incredibly unfortunate. We need to get ahead of it so we won't see a surge of something like diphtheria or polio or measles, which is entirely preventable.
Right, and many of these diseases nearly eradicated because of vaccines. We've seen the same hesitancy in the U.S. as we're seeing in some of these other countries?
Yes, the U.S., fairly decent amount, but we're seeing UNICEF said this is a worldwide phenomenon, and it's not just the U.S.
So in the pandemic, we saw the gap widen in stroke deaths, particularly more Black people dying than white people from stroke. Why is that? What does the data show?
Sure. So we've been doing a good job overall in trying to prevent stroke. Stroke is when an artery gets clogged up or ruptured that prevents blood flow to the brain. Now, when it comes to stroke, there's certain risk factors that lead to a stroke happening, such as high blood pressure, obesity, smoking. And during the pandemic, we saw people being more sedentary. They weren't going out as more. They were working from home. So the obesity problems started to worsen. Also, substance use started to worsen during the pandemic. So there's always been a gap between a racial gap between the number of strokes, but this gap is increasing even more, partly because access to care got a little bit harder during the pandemic. People feared going to see their doctor because they were worried about being exposed to the virus in the early stages of the pandemic. And also the problem with obesity and substance use just caused this rate of strokes to increase even more. And as always, the health disparity that we saw just started to widen. So we're estimating about 22% gap between the stroke death rates between the underserved Black and Hispanic community versus the Caucasian community.
Finally, we have seen some really tragic events in the last week of people being shot, showing up at the wrong house, getting into the wrong car, pulling into the wrong driveway. Psychologically speaking, since you're a psychologist, what are some of the factors contributing to this? I mean, one thing that I had heard is people have a lot of fear in them right now of a rise in violence in small communities in our big cities. I mean, is that playing a role in people arming themselves and then reacting in ways that we've seen play out?
Of course. So first of all, as a society in general, we've become more hypervigilant. We've become more paranoid. We've become more short fused in recent years. And I'm going to go ahead and try to blame strategic marketing on the NRA's part, and then a little bit about right-wing media, that they've installed this fear that everybody's the enemy. You need to protect yourself from your neighbor, from your friends, from the government. So it's created a nation that's hypervigilant and on alert. And what happens when everybody's hypervigilant is you act before thinking. If there's a perceived threat to you, not even an actual threat, a perceived threat, you're likely to engage in something as violent as shoot versus think about it first and do that. So I think as a nation, we're just hypervigilant and on alert and paranoid, and that's what's causing us to react.
Yeah, and lead to some tragic results. Dr. Safia, thank you.
Thank you so much.